It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was, why does the ICU team say my brother will not survive when he managed to be off the ventilator for 8 hours? You can check out last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer questions that we get quite frequently as part of my one-on-one consulting and advocacy service, and it's a very topical question as we are entering May 2020, and obviously many loved ones have family members in intensive care at the moment with COVID-19, and that is certainly concerning not only on a clinical level, it's also concerning, quite frankly, because family members are locked out of ICU because ICUs have pretty much, or hospitals have gone into lockdown because of fear that the infection will spread even further. So the question that I want to answer today is really why COVID-19 can make someone critically ill. So during such an unprecedented occurrence that caused the world to change drastically, it has impacted over 100 countries all around the world. The COVID-19 gripped the global community by fear as cases continue to mount every day, and containing the virus seems impossible. Billions of lives are at risk and people are dying. Most hospitals and the ICUs are at breaking point. The culprit, coronavirus disease 2019. So how did it all start? The outbreak apparently began in Wuhan, China, a city with a population of over 11 million people. The virus is believed to have originated from a quote-unquote wet market where animals such as bats, snakes, rabbits and birds are illegally sold. As the coronavirus is known to be transferred from animals to humans, it is believed market stallholders who came into contact with animals were the first people infected with the strain. A 61-year-old frequent shopper at the wet market was the first person to die from the virus, apparently. This new virus, called the Severe Acute Respiratory Syndrome Coronavirus 2, in short SARS-CoV-2, has been identified as the cause of a disease outbreak which began in China in December 2019. On February 11th, 2020, the World Health Organization announced an official name for the disease that is causing the outbreak. The disease is called Coronavirus Disease 2019, abbreviated as COVID-19. In COVID-19, CO stands for corona, VI for virus, and D for disease. Formerly, this disease was referred to as 2019 novel coronavirus, or 2019 nCoV. This particular strain of coronavirus is referred to as novel, as in it has not been seen or identified in humans previously. There are many types of human coronaviruses, including some that commonly cause mild upper respiratory tract illnesses. COVID-19 is a new disease caused by a novel or new coronavirus that has not previously been seen in humans. The virus is a type of coronavirus, a family of viruses that can cause illnesses such as the common cold, severe acute respiratory syndrome, SARS, and Middle East respiratory syndrome, MERS. So how does COVID-19 spread? COVID-19 is a new disease, and we are still learning about how it spreads and the severity of illness it causes. First is person-to-person spread. The virus is thought to spread mainly from person to person. It also spreads between people who are in close contact with one another within about 6 feet, or 180, 185 centimeters. It also spreads through respiratory droplets produced when an infected person coughs, sneezes, or talks. The droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Recent studies have also suggested that COVID-19 may be spread by people who are not showing symptoms. So therefore, maintaining good social distance, about 6 feet, is very important in preventing the spread of COVID-19. It also spreads by entering the eyes. So let's look at the spread from contact with contaminated surfaces or objects. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. This is not thought to be the main way with the virus spreads, but we are still learning more about this new virus. CDC recommends people practice frequent hand hygiene, which is either washing hands with soap or water or using an alcohol-based hand rub. CDC also recommends routine cleaning of frequently touched surfaces. So how easily does the virus actually spread? How easily a virus spreads from person to person can vary. Some viruses are highly contagious, like measles, while other viruses don't spread as easily. Another factor is whether the spread is sustained, which means it goes from person to person without stopping. The virus that causes COVID-19 is spreading very easily and sustainably between people. Information from the ongoing COVID-19 pandemic suggests that this virus is spreading more efficiently than influenza, but not as efficiently as measles, which is highly contagious. COVID-19 is thought to spread mainly through close contact from person to person in respiratory droplets from someone who is infected. People who are infected often have symptoms of illnesses. Some people without symptoms may be able to spread the virus. People are thought to be most contagious when they are most symptomatic, the sickest. Some spread might be possible before people show or experience symptoms. There have been reports of this occurring with this new coronavirus, but this is not thought to be the main way the virus spreads. Studies indicate that the SARS-CoV-2 virus, which is the virus responsible for COVID-19 infections, can survive on hard surfaces like plastic and stainless steel for up to 3 days, on cardboard for up to 24 hours, and on copper for up to 4 hours. Fortunately, regularly cleaning and disinfecting these surfaces is effective for removing and destroying the virus respectively. What are the symptoms? Reported illnesses have ranged from mild symptoms to severe illness and death for confirmed COVID-19 cases. These symptoms may appear 2 to 14 days after exposure based on the incubation period of MERS-CoV viruses, such as fever, cough, and shortness of breath. Severe symptoms of COVID-19 that require immediate medical attention include difficulty breathing, persistent pain or pressure in the chest, confusion or inability to arouse, or bluish lips or face, the latter indicating a shortage of oxygen in the bloodstream according to the CDC. COVID-19 has the potential to cause even more fatalities because it's easily transmitted. The population lacks any immunity to the disease, and complications in serious cases may include life-threatening pneumonia. Others develop sepsis or a syndrome of multi-system organ failure with renal and endothelial collapse, making it difficult to maintain blood pressure. Like with so many pathologies, it's a vicious cycle in where everything gets overworked, which then leads why a loved one needs to be in intensive care or ICU as they become critically ill because of COVID-19. Severe COVID-19 leads mostly to multiple organ failure, starting from lung failure or ARDS to kidney failure up to cardiovascular failure. ICUs treat patients who are on these life-threatening conditions and whose organs have failed. These types of conditions need the intense and prompt treatments which can only be provided by the ICU and intensive care units, as these conditions are rapidly fatal. In more simple terms, treatments include a ventilator taking over the patient's breathing while the patient is placed in an induced coma, a dialysis machine cleaning the blood, and the drugs giving of inotropes or vasopressors that supports heart function, prone therapy, which is basically turning critically ill patients on their stomachs to allow gravity to remove mucus buildup in the lungs, which then opens both the airways and gets more oxygen into the air sacs and improves circulation to the lungs. Of course, they need to be in an induced coma as well, and they often need to be paralyzed as well to tolerate such prone positioning therapy. And last but not least, there is ECMO, which is an advanced life support machine that provides long-term breathing and heart support and is used only when all of the standard treatments for these problems have already been tried in lung failure or ARDS. The reality of care is, of course, considerably more complex and highly intensive, as I can explain in this video. The challenge from COVID-19 to ICU services globally is enormous and pressing due to these unexpected surges of COVID-19 patients needing ICU. Now, the reality is ICUs don't have enough beds. ICU beds are a precious and scarce resource in terms of beds, staff and equipment. Most ICUs therefore run at or above 90% bed occupancy and often can only admit new patients by only discharging others, even when workload is normal outside of a pandemic situation. COVID-19 will dramatically and has dramatically increased pressures not only because of weight of numbers, but also because intermediate treatments for pneumonia and lung failure are aerosol generating. That means they risk spreading the disease, so they can't be used and early recourse to ICU is required. It's very alarming to think, but one way to unfortunately manage beds in ICU is to deny some patients treatments and eventually worst comes to worse, let them die or not admit them into ICU in the first place and let them die before they even go into ICU. We can see now that this is already happening and it has been in the news worldwide, and it's very sad. If you have followed my blog for any length of time, you know that I'm always highlighting that ICUs sometimes let people die because they need beds. So this issue is even heightened at the moment with the pandemic situation. With the rapid increase in the cases of COVID-19, it demands for more provision of ventilators and ICU beds, which then equally equate for the need of more ICU nurses and more ICU doctors. Skilled ICU nurses and skilled ICU doctors are a limited resource. ICU is such a highly specialized area, and ICU needs only ICU nurses that are well trained to operate machines like ventilator and perform medical interventions that only skilled ICU nurses can do. It's not going to be overnight that we can create and train ICU nurses and ICU doctors, because it takes a lot of profound practice at the bedside and many years of experience in order to hone the skills and be well equipped for both patients, nurses and doctors' safety. It's not only that you can't train ICU nurses or ICU doctors overnight, they also have to be the right fit for the environment. Shift work, unsocial hours, dealing with difficult personalities, death, end of life, and the list goes on. It's not for the faint-hearted, and if they think it is, they're probably not carved out for the environment. Just because there will be an increased demand doesn't mean you can just grow ICU nurses and ICU doctors on trees, because you can't. Other concern is relatives are locked out of the ICU and out of hospitals and are not allowed to visit their loved ones due to the fear that they might be bringing in the virus inside the hospital or getting infected themselves, and relatives are left in awe. But it is also possible that they won't allow relatives to come visit their loved ones so that they can run their agenda. The biggest challenge for families in intensive care is that they don't know what they don't know, and they often don't even know what questions to ask. And so here, our consulting and advocacy service for families in intensive care will guide families how to manage intensive care teams, how to ask the right questions, and get the outcomes that they want, need and deserve for their loved ones. Once you know what questions to ask and once you know what to look for, the dynamics change in your favor, because then ICU teams know, oh, you're actually talking to someone that understands intensive care, and that is important. It's actually a matter of life or death. And this then might save your loved one's life. Now, there is no end in sight currently when this pandemic situation with COVID-19 is actually going to end. It could go on for many months, perhaps maybe even years, until a vaccine becomes available. It is very likely such measures, most notably large-scale social distancing, social lockdowns, will need to be in place for many months, again, maybe even for years. The effects on countries and the world will be profound. Scientific developments were on the horizon. Everyone is praying and hoping that this crisis we are facing right now will end soon. What we're after are thousands of lives can be saved. Keep strong amidst this trial. Everything will come to pass. So, question that you need to ask yourself is, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control power and influence quickly whilst your loved one is critically ill in intensive care? Well, you will get to that all-important feeling of making informed decisions, get peace of mind, control power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. Or you can call me. Find phone numbers on the top of the website. Also, have a look at our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one consulting and advocacy with me over the phone, via Skype and via email by clicking on the product tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in a few days.